Hello again. I'm gonna try to keep this lecture a little shorter than the last one. That was kind of a marathon. And a lot of this you've already heard, by the way. So it won't be unfamiliar to you. We're going to talk about the differences between men and women related to cross-cultural therapy. And this is from a pastoral perspective. So some of this you've heard already, but we're going to change the perspective just a wee bit. So let's jump right in here. Um, the experience, I'm trying to think of a good place to start with this because it is somewhat repetitive. We're talking about the experience of cross-cultural therapy related to men and women. They respond to this. They interpret it differently, and how do you affect that? So what we need to do is when we are engaged with a man or a woman, we have to bear in mind, and these are some of the parts you've heard already. What is their cultural background? We want to be approaching this with wisdom, with a lot of humility, and with a lot of care. We're not dealing simply with a person's private struggle. We're dealing with family expectations. So, and within that realm, community values, religious beliefs, you're engaging family expectations, community values, religious beliefs, along with gender roles and cultural influences. We like to sometimes call those scripts. And all these things shape how distress is expressed in the particular culture. So we're in a situation where we have a good working system. It connects theology, relational care, and practical helping. Practical helping from a science standpoint. I don't need, if I'm your counselor, I'm not only going to listen for symptoms, I'm also going to listen for meaning. What does suffering mean in your culture? What is expected of a woman in this family? What is expected of a man in your family, in your culture? How do faith, shame, honor, duty, communal responsibility affect the person's willingness to speak honestly? What can we heal if we don't have honesty? Nothing. I won't even know what to treat. So the client has to trust you enough to be honest. And to get to that point when you're not of their culture, you have to earn that trust. So what are we dealing with here? Cross-cultural therapy begins with the recognition that counseling is never culturally neutral. You heard that in the last lecture. The same behavior can mean different things in different settings. Silence, for example, might be a sign of respect, where in another culture it may be a signal for depression, fear, resistance. Direct eye contact might be viewed as confidence in one culture and disrespectful in another. These are things you've heard. I want to reiterate them because they're important. So, what is my first duty? My first task is not correction, but understanding. I got to know what I'm working with. So I might ask, how does this person's community describe the problem? I'm asking this to myself. What are the spiritual and social meanings attached to it? Emotional distress in some cultures may be interpreted through family conflict, spiritual attack, social disharmony, as opposed to individual psychology just by itself. So I need to hold together spiritual care and psychological insight and not put one or the other on a pedestal. I can't emphasize one without emphasizing the other. They don't want a dominance here. So what's a good example of this? Well, let's use a collectivist background. That's the one we're not as familiar with, some of us, because if you're from here, you're an individualistic, trained person. Collectivist cultures, obviously, you know the difference. So you have a female from a collectivist culture who comes to counseling and is coming because of anxiety. She frames her concern as failure to honor family obligations. A man from the same culture may come with anxiety and describe things like irritability or work stress. Never mentions grief or fear or things that the woman might. Both cases, you got to listen for the deeper story. If you think about it, I told you not too long ago that behavior is empirical. What produces the behavior is mental processes. Empirical, i.e., observable, mental processes, not observable. That's where therapy and questioning comes in. Okay, good. Let's talk about the importance of gender. Women and men are often socialized to express discomfort slash pain differently. Women are permitted to speak more openly in some cultures about relationships and emotions, while men are expected to be this macho thing, strength, resistance, self-sufficiency. They don't always apply the same way from culture to culture, but they most often shape how help is sought, how distress is expressed, how trust is built, and how shame is managed. Now, you may have known the answer to this before, I'm not sure, but who's the more emotional gender, women or men? Think about it for about 5 seconds. The answer is neither one dominates. We're all emotional creatures. Who expresses it more frequently? Females. So you're having to filter through that. And building this trust is a difficult thing to do. A woman comes to see you from a particular culture, they may feel pressure to preserve family harmony, to avoid confrontation, to endure abuse without saying anything, doing it for the sake of the children, or the sake of the reputation of the family. And a man may feel pressure to appear competent and emotionally controlled, even though he might be overwhelmed, might even be lonely, he might be spiritually discouraged. If you as a counselor assume that one style or the other is normal, then you've missed the boat. You've misread both men and women. So pastoral sensitivity is essential. You should avoid stereotypes. Women are emotional. Men do not talk. Because there are some women who don't show emotion out of protective reasons. Ask how gender roles have been taught, enforced, rewarded, punished in the person's particular culture. Ask how they've been dealt with in the religious community. That honors the person and it doesn't intimidate them if you're asking it in the right way, lovingly, for example. There are 5 questions as a pastor when you're doing an assessment that you need to ask. And you may want to jot these down. Number 1, what is the presenting concern? Why are they there? What, why, when, where, how are the 5 psychological therapy questions. This is similar to that. What is the presenting concern? What's wrong? Number 2, what cultural values shape the person's understanding of the problem? Cultural values. What gender expectations influence the person's role or the choices they make? I'll go back through these quickly. if you missed something. What spiritual beliefs support or burden the person? And finally, what family and community pressures are involved? So number one, what is the presenting concern? Number two, what cultural values shape the person's understanding of the problem? Number three, what gender expectations influence the person's role or choices? What gender expectations influence the person's role or choices? Four, what spiritual beliefs support or burden the person? And finally, what family and community pressures are involved? That kind of assessment is important in multicultural settings because religious conviction, family loyalty, and social identity all can shape the counseling process. Actually, in some cases, it's what looks like resistance may actually be caution. It might be respect. It could be fear of bringing shame on the family. And then in other cases, what may look like low motivation for us may reflect a history of being dismissed by authority figures. So, and authority figures can come from everywhere within the family, outside of the family, doesn't matter. So you need to use some things. How do I put them at ease and win their trust? Use empathy or sympathy. You know the difference. Empathy, I've experienced what you are experiencing, but never say I know how you feel. That's wrong. Sympathy is I've never experienced it, but I feel badly for you. Uh, so use empathy, use careful communication. Think about what you're going to say before you say it. It's okay to maintain a bit of silence as you phrase your comment, and then have a non-judgmental presence. Be very aware of your own facial expressions. Best to be neutral as you can be from a physical standpoint. So you don't want to impose a solution quickly, but you want to win trust and you want to understand the story well enough to offer guidance that fits into that person's world. Ask questions. So after you assess it, then we do intervention. Cross-cultural pastoral counseling should have interventions that are simple, respectful, and collaborative. It's not like, here, go do this. It's collaborative, simple, respectful, and collaborative. It's called narrative approach. Discussion. The discussion is very useful because it helps people reinterpret their experiences, but yet it doesn't do away with their cultural identity. So you're all the time asking, how is this dealt with? Or how do you feel like it should be dealt with? Or stuff like that. Brief approaches. Don't drag these things out. They're helpful because they focus on the strengths. They focus on the goals that you and the client set. And they lend themselves well to manageable next steps. In particular for women, you by following these examples or following this approach, the example creates hopefully a safe space that gives them a place to name fear, to name trauma, to discuss relational pressure, or even spiritual confusion. And it gives them time to analyze all this stuff. Because if you're immediately saying, well, here's how we're going to fix this, no. That you can't jump right into reconciliation without knowing the full extent of the problem and all the details. And then for men, it might be inviting some first-time emotional language, honest emotional language. And it's done in a way that they can preserve their dignity and avoids humiliation. And you have to be collaborative with that. Ask them to name things. Don't name them for them. So use language that matches the person's cultural framework and even their spiritual framework. You might say things like, tell me how your community would understand this struggle, or what has your faith taught you about this, about endurance or healing. Those kind of communications respect and even invite a person into a process of reflection that's meaningful. And it reduces cultural domination. You got to be careful with that, where your worldview overwhelms their own story. You don't smirk, for example. Don't do anything that lends itself to misinterpretation of what you're really thinking. And then you got to be ethically conscious. You got to be careful not to do things like romanticize culture, excuse abuse. Oh, I know that's common in your. Don't say stuff like that. Confuse respect with silence. You have to ask questions. Are you okay with this question? Are you okay with this? Whatever. Some cultural norms support resilience. Some support belonging. Others may reinforce oppression, especially oppression against women, oppression of children, or even immigrants into their culture. So be careful with your word choice. You got to be able to distinguish between honoring culture while not tolerating harm. Protecting family privacy, for example, is not always healthy, particularly in domestic violence situations where frequently it's hidden. Male stoicism, the stereotypical German thing, it's very stereotypical, by the way. My family's German. Encouraging male stoicism isn't helpful if it prevents the male from seeking treatment. And this could include treatment for things like depression, addiction, suicidal thinking. We're dealing with some touchy areas there. So, counselors who listen carefully, think contextually, and respond with theological and emotional intelligence are good counselors. You can't erase culture. You can't erase cultural. Excuse me. You can't erase gender differences, but you can engage them with humility and compassion. Okay, so I hope that's a good one for you, and I'll be seeing you soon.